HIPcast is brought to you by Enterprise Social Record, and today's sponsored episode is brought to you by Enjoin.
Well, we have a really fun conversation today. We have a vendor conversation happening with an HIM professional. We are going to ask a lot of questions, but really we want to express the innovation and collaboration between vendors and health information professionals. We're going to talk about how these relationships really not only do they make our lives better and highlight our profession as the leaders in particular spaces, but it also allows vendors the creativity to tap into the creativity of our profession to create solutions that just make healthcare more efficient. And whether that's clinical care or processing through things for coding, for CDI, for billing, whatever that is. So today we have Dr. Melissa Kohler. We affectionately call her MK, just because Melissa Kohler is too much to type out in a group text that we share a lot. So we've become, we're just kind of now our initials. And so you all probably know Dr. Melissa Kohler. She is a leader at the state level for Tennessee Health Information Management Association, also a leader consistently at the national level on program committee for the annual meeting, on multiple work groups, community of practice or body of knowledge type contributions. Her volunteerism never stops. And then we also have with us today the CEO of Enjoin. And Justin says that I can dump everything else that we know about him and just say that he married into the Ohio State fan base. But I'm not going to do that because this is an SEC podcast. I'm kidding. It's not an SEC podcast. That's just the host. But Justin Smith is the CEO of Enjoin. He has significant experience in mid-revenue cycle, renowned for his strategic acumen and visionary approach. He consistently demonstrates exceptional ability to build, scale, and high-performing products. So this conversation is going to be about coding, CDI, innovation, and collaboration. I'm so excited. Thank you both for being here. All right. One quick thing, Melissa, we always know that you are such a contributor and you are always on fire. Justin, I would love it if you would do just a quick introduction of kind of what you want people to know about you as we roll into this conversation.
Sure. So my background, I've been in mid-rev cycle for 21 years now. Been CEO of Enjoin since 2022. Prior to that, started my career really, I guess, in nurse staffing and home health before starting a company, Peak Health Solutions, in 2004. And so with Peak, we did really mid-rev cycle solution staffing. Ended up being acquired by AMN Healthcare, and so headed up rev cycle for AMN. During that time, we had acquired a company, Med Partners, and then created one of the largest mid-rev cycle divisions for AMN and then moved to Enjoin in 2022, and just have been on a tremendous ride with them, and just great to have an opportunity to work with the likes of Melissa and Nova.
That's awesome.
That's great. So I'm going to turn it to Melissa now and ask you, give us, what are you doing these days? We kind of know, but I know I know what you're doing these days, but tell us what you're doing. Tell us about your department's role within your organization and the responsibilities you and your team manage day to day.
Before you do, would you please tell about your recent promotion, because it's a big deal and I want everyone to know.
So it's funny that you say that, Shannon, because you and I haven't had a chance to catch up, but I actually have another promotion since
That's
then.
amazing. I told you she's on fire.
Yeah. It's not officially permanent yet, but just a couple weeks ago, I think it's 2 weeks in now, I was named interim AVP of Health Information Management at Innova. So
Congratulations.
Thank you. My responsibility has widened just a bit, whereas prior as Senior Director of Coding Operations, I had PV and HP coding And now I have gained inpatient and outpatient CDI, in addition to retaining PV and HB coding, and then HIM operations as well.
That is
So
awesome.
getting a
Amazing.
little bit busy.
Congratulations. No wonder you're barely texting me back.
That's exactly why. That's exactly why. So yes, interim, my longtime boss and mentor, Mr. Ron Tapnio, is moving on to bigger and better things, and I am, very happy for him. But he is going to leave a hole that I am supposed to, at least on the interim level, fill right now. And but I'm excited. It's a new journey for me, and it was an aspiration in my career, so I feel like
Awesome.
I'm realizing those goals.
That's amazing.
So in terms of your question, Seth, in the HIM division at Inova, our responsibilities really are to ensure coding accuracy, documentation, making sure documentation supports all the code assignments that our team applies, looking at regulatory compliance across both inpatient and outpatient settings. We support revenue cycle operations through accurate code assignment, collaboration with CDI from the coding perspective. We have oversight of audits and denials, and our work really does impact financial performance, quality reporting, and ultimately the accuracy of the patient record or the patient's story.
So it's a big task is what it sounds like.
It's a huge task. Very complex.
Yeah.
Such a huge task. So before, Melissa, before bringing on a partner, what kind of specific challenges or pain points were you kind of facing, either you yourself as a leader or maybe your team as a whole? And then what made it clear that it was time to go outside of your internal resources?
So I think the biggest pain point that we've always had is that the volume of patients, the volume of encounters just steadily increases, month after month, year after year. And revenue cycle is, especially mid-revenue cycle, I will say, is expensive. They're highly skilled workers. We're not a revenue producing department, I guess is the best way to say it. Although I
disagree, but I know CFOs view us as non-revenue producing.
I disagree too, but that's how it's looked at, and so we have very important jobs, and they take time. They're complex. They're not things that can be rushed through. And so what we were facing is that we knew that our CDI team and our coding audit team, our retrospective, audits, could not touch every single record.
Yeah.
We were seeing huge improvements over the past several years under our great leadership from Ron in terms of increasing our CMI, our CC/MCC capture rate had steadily improved over the last 4 years. So we knew that all of the internal things that we were doing, internal initiatives and focus, were resulting in improvements, great improvements. But we also knew that we had not covered everything. And we wouldn't be able to with existing staffing. There was never going to be a point in time that we could increase our coverage rate such that we would be able to cast that wider net and really hone in on the opportunity that we knew was still there.
I love that answer because, as I'm listening to you, you didn't go external for support because you just couldn't, because you didn't have a qualified staff, or because It was just the volume, and your staff, while making improvements. And I think that's important for other HIM leaders to recognize that if you go external for help, it's not because of a failure. Sometimes it is, right? But it's not always because of a failure. Sometimes it's just because your hospital is operating efficiently enough to keep up with X, and you've got to go outside to do even better, right? To make the most efficient gains. So I think sometimes we view having to outsource things or go external for vendor support or whatever our solution is. Sometimes we might view that as we had to do that because of a failure, but this is not the case here. And I appreciate the way you kind of laid that out.
Correct. And I will also add too that when we were looking for a solution, we knew it wasn't just going to be add bodies of the same caliber as we already had. we knew that we needed a solution that could get deeper into the clinical aspect of CDI and coding. And for those of you that don't know CDI or coding, and I'll just call out Seth, who doesn't know it, um, it can be very, very complex. You think about a patient who is admitted that has multiple conditions, and any one of those could have been the reason for their admission. Sometimes it's not just black and white in the clinical documentation that exists, and it takes that deeper understanding. And that's exactly what we were able to find in Enjoin, because it is clinically backed. And so we knew that going with a partner like Enjoin was going to not only help us to review some of the cases we knew we couldn't get to from a staffing model, but even those cases that we were reviewing, give us a deeper understanding of the clinical aspect of those reviews.
Yeah, I
Well, I
love
like
that.
that you call it a partner. That's
It
the
is.
key. I live on the vendor side of the world now, and it's true. And back 1,000 years ago, it was the vendor term, but it's not a vendor really anymore. It's a partner to help us do these things. So, speaking of that partner, Justin, tell us about Enjoin. Give us a high level overview of Enjoin's solutions, and from your perspective, were there any surprising moments or findings that sort of reshaped how you approach the process with your clients?
Well, no, I appreciate that. And just want to say, and this is how we look at all of our clients, but, specifically with Inova and Melissa, really we are an extension of the team. And that's really important to us, in that we're collaborating with her team and her coders and her CDI team, and I'll get into this, but in providing really kind of education based on our findings so that ultimately that team can learn. And so why don't I kind of just start with maybe just a little bit about Enjoin. And so we are a physician-directed mid-review cycle solutions company. And so we focus on improving clinical documentation and coding accuracy, ultimately through DRG management. And so we've been doing this for a long time. The company was founded over 35 years ago, and really with the goal of ensuring that the physician's care would be accurately translated through coding and documentation. And so what this does is it ultimately leads to the hospital being reimbursed appropriately for the care that we're giving. And so from a services perspective, and this is what we're known for, is our DRG assurance or pre-bill service. And so that's really where we're focusing on revenue lift, revenue protection, and ultimately denial prevention for our clients. And then we really wrap this around with education and denial support as well. And so with Inova and Melissa, it's pretty interesting, because as we start an engagement, right, really from a sales process, we're looking at public available data to determine, do we think that there's an opportunity with this client? And so as we did that, we found that there were opportunities. And so we worked with Melissa and her team to do a complementary assessment, which is where we come in and we will look at their actual data and then do actual case reviews. And so based on that analysis, we're able, through our advanced analytics, really prioritize where we can find those kind of high value, high impact opportunities. And so that ultimately is what we're able to do in the pre-assessment. And then we report that back to the Inova team, and obviously through that complementary assessment, we really wrap our full service around it. So we provide education and a full executive summary and review for that. But I'd be interested, just from Melissa, from your perspective, just kind of maybe some of the ahas you guys got from, that review that we're able to do, at least from the complementary standpoint.
Yeah, so Justin, going back to the complementary assessment, we had several insights that were telling us that we do have opportunity that we are not able, to find on our own. So we had some suspicions that you guys were, Enjoin was going to be able to find some opportunities, and then obviously you did, from both the coding side and the documentation side, the CDI side. If I recall, it was about 50-50. It was very close in the terms of recommendations that were opportunities that were found in that complementary assessment. But I think what was most insightful to me is that it wasn't the things that I expected you to find. It wasn't missed CCs or missed M's. It wasn't like we were just missing things, making silly mistakes. It really did come down to Well, this case had, more than one diagnosis that could have been selected as the principal diagnosis. And here's why it should have been this, So it was really from the clinical aspect and your team's expertise and being able to show us the why from a clinical perspective of which diagnosis is really supported as the principal. And those are tough decisions for a coder to have to make. And then also we had some aha moments too on the documentation side, query opportunities that were missed, and not because our team was going too fast or we weren't being thorough enough. It's because it was a new concept that they were not aware of.
Yeah.
And so it was very enlightening.
Wow, I love that. So, Justin, this is not necessarily in our prep discussion about this, but I love the depth of this conversation.
You mean we're going off script already?
Are you kidding me? We're halfway through, and I'm just now going off script.
No, it's a record. We made it 15 minutes.
Sure. But I'm curious about, so Melissa, what you were saying is that there were some new scenarios or some new connections or some new guidelines or something that probably not guidelines, but scenarios most likely, that the machine computability was aware of or able to isolate, where a coder doing a great job just did not necessarily know to look at that. So Justin, my off script, feel free to tell me you're not going to answer that if you want to, but I'm curious, and I don't want you to give away any intellectual property, of course, but your computability, first of all, the power that you use in your computability, but the logic that you use to find these, how does Enjoin keep up with all of those different variables? Because this is my part of my life is data governance and AI governance for AI. Yeah. So I'm so curious how you keep up, how your team keeps up with the variables that change consistently, as we all know, with new codes or contracts or medical policies or coverage determinations, whatever it is, coding guidelines. How do you keep up with that? What's your maintenance schedule? It must be insane.
Yeah. So a couple things, which I know you talk about technology and AI, which I think we'll get to a little bit later in the podcast. But from that standpoint, so we have a very deep team in our learning and development department. And so they are really responsible not only for creating the education, but really staying up on all of the latest, coding changes, et cetera. And then what is also critical to, the organization and the delivery of our service is really the physicians. And so our physicians are the cornerstone of the organization. They all are board certified. They have a background in coding and CDI. And so that combination of L&D coupled with really that clinical lens that the physicians bring to the reviews and the recommendations, it's really ultimately how we, and then all of that ultimately is updated within our predictive analytics and what we call our focus list that really help drive those returns for our clients.
That's awesome. So, Melissa, how did your team respond to this? And then, obviously, we know as friends that your organization responded by rewarding you with more work, what we will call promotion. And it seems that you've had even a second one since we got to catch up about that. But how did your team respond? And then give a discussion a little bit, if you don't mind, about how your leadership team also responded.
Sure. So I will tell you, it was a different response than what I expected. So if you think about a traditional coding audit or CDI audit, most of the coders and CDSs are very defensive when somebody tells them you should have coded this way, or you missed this query opportunity. But because of the approach that Enjoin takes, and that they explain the why, and it's with evidence within the record, and it's backed by guidelines, industry standards. It's very easy for those to be accepted. Sorry, that was one thing I forgot to turn off.
It's all right.
My garage door just opened. So they were much easier accepted by the team because they truly were learning opportunities, learning moments, not just, hey, you missed this, you should have coded it that way, which is another reason why the Enjoin team has been and the process has been embraced so well at Enova from both the coding side and the CDI side, which is really unheard of. Usually, and I say this all the time, I still say it today, and it does not apply to Enjoin. I don't think physicians have any space being, shouldn't be coding. They don't know how to code. And I can't say that for the Enjoin team because their physicians do know how to code. And so, I have to accept that. But it really was a different approach in that it's not just about, this is what you're doing wrong. This is what you should have been doing. It's telling them the why. It's teaching them. It's those teaching moments that both the CDI and the coding team are experiencing with the feedback from Enjoin.
Yeah. Is that, Justin, your deliverables there, your team, is that a combination of, meetings and going over? Does it come out in a report? And then in that report, you just kind of go over that report? How's that work?
Yeah, so I mean, it really is a multitude of ways that we approach it. And one thing I just want to mention, just that Melissa had said, it's really critical for us that in order for a program to be successful, we have to have buy-in from both the coding and CDI teams. And so that is just really, really important. And so, we take the time where we're giving feedback on a daily basis. And one of the unique things about us too is when we surface the recommendations, they are just suggested. So ultimately, the client has to accept our recommendation, and they have the ability to not do that. And so, based on that, there's all sorts of learning experiences and ways for us to educate and explain, both on what they do accept and, why we feel this way. And then we educate them through education. We have education meetings as well as engagement calls that happen on a monthly basis. To give that opportunity to have targeted education around these things. And then on ones that are not accepted, really it's if we continue to find those opportunities, continuing to educate them on why they may want to accept that. But again, only if they're comfortable from that standpoint. And we do try to validate, the literature behind why, we feel that this is an accurate recommendation.
Yeah, I love your the conversation between the two of you. What I've heard multiple times is they offer, they recommend, we agree, 50-50, we agree, we don't agree, different things. But on both sides of this conversation, both at Enova and as well as in Enjoin, there are humans in the loop doing decision making, which
Correct.
and a lot of maybe in today's space, a lot of people want to hand off an AI tool and just say, here you go. And there's not that's technology. Great. I'm not saying it can't do wonderful things, but from a partnership and collaboration perspective, you got to keep those humans in the loop. And it sounds like that this relationship with Enjoin and their clients do exactly that.
Yeah, truly a partnership. That's
Absolutely.
The fascinating part about it. And that's the thing is, I think, Justin, you mentioned it's an extension of the team. We're all in the same boat rowing together. And I think that's the important part about it that our audience and other health information professionals can take from this is we're all in the same boat. We're rowing this together with the right partners like Enjoin. But you mentioned AI, Shannon, and Justin, you even mentioned it a little bit ago, with that AI and technology space, which is the world that I live in and Shannon lives in. A lot of this is foreign concepts to me. Not foreign. I have to get the CEUs every year, but I quickly flush it out of the brain about RevCycle. But it's limited storage space. But with AI and technology evolving in the coding and CDI landscape, where do you focus your attention? And is it more about driving efficiency with the teams, or are there other strategic priorities that you have in mind when it comes to this evolving technology world?
So I can take that question first. At Enova, we're definitely focused on efficiency, and if you know my story, I've talked about AI and automation tools on several levels. I am definitely a proponent for it. I used to be in fear of it. I am not, because I just had a realization that we can't continue to do the same thing and expect a different result. We don't grow coders and TDSs as we once did, at the volume that we once did. Mm-hmm. And so we are focused on efficiency, but also on long-term sustainability. As we adopt any type of AI tools or automation, we are always going to prioritize quality and data integrity. We are never going to skimp on that part. In addition, upskilling our workforce, which I have done, successfully over the past couple of years, to work with that technology, not around it, is critical. And we're also going to use health information as a strategic asset, connecting coding, documentation, quality, for a more complete view of patient care. It all intersects anyways, and we have to make sure that the quality continues throughout the continuum.
Health information is a strategic asset. I love that.
Health information, in my opinion, in healthcare, data as an asset is only second to human capital, period. Like, data as an asset is the most important asset that we have besides humans. I will not stop saying that ever. That is, well, maybe I will. Maybe robots will someday replace that, right? But as I see it today, in today's world, data is only second to human capital for sure.
No, I'll be honest, I couldn't agree more. I mean, I think we have to embrace technology, and we are here to Enjoin, but that's not at the elimination of, the human intervention and the human review. So I think the combination of that is much more powerful than just technology alone.
Yeah.
What do you look? Yeah, go ahead, Shannon.
Keeping the human in the loop, as you were talking about, I know there's some new pushes, and I don't know how much you guys keep up with technology outside of just healthcare, but I'm watching power generation and, SMR. How are you going to create enough power to compute all, to have the energy to compute all these things? But keeping the humans in the loop currently, we have to, because we don't have enough guardrails in place for the inputs and outputs, the governance of those inputs and outputs from AI for sure. I want to see us get there, because AI is so, and I love that you said you used to be in fear of it, because some of us still are. And a healthy fear, I think, of everything is good. Like, just not a paralyzing fear, right? You're going to have to move. And I think maybe the most significant reason we need AI processing some of the things that can be processed effectively, even if we're not talking about Gen AI, even if we're not talking about clinical decision making, even if we're just talking, even in just mid-revenue cycle, right? Even if you're just talking about from the time a code hits a chart in the EMR to how it flows through the entire system till you get that back on a remittance advice, right? And the money gets in the bank. Even if you talk about it from just that perspective, you have to have the humans in the loop, because somebody has to make sure that those things don't drift, that updates happen, that all of those components are part of the whole cycle. It's definitely a life cycle of every data element, in my opinion. So it sounds like Enjoin is pretty consistently paying attention, using technology and human resources together to make huge efficiencies gained for their clients. So I guess a question for you, Justin, that's also not on the script. What kind of fun things, outside of what you're doing with mid-revenue cycle, what kind of fun things is Enjoin, or even just Justin, looking at in terms of AI in healthcare? Is there anything? Don't tell me your secrets that you have on your strategy, okay? I'm not asking for that, but like, are you guys creating humanoid coders and CDIs?
That's where my question was going. Was what's the future? Because it's exciting, right? What's the future look like?
Yeah, no, I think for us, it really is a matter of, I will say, my whole focus around technology, aside from learning, is I'm learning outside of Enjoin, but how we could apply that to Enjoin. So my main technology focus is really, within Enjoin, and it's about how can we, because in the way we operate here recently, we are identifying the DRGs, from a focus list based on our analytics. Well, we're wanting to now take that to the next level with being able to review 100% of the inpatient discharges, and then have the technology identify those ones that have an opportunity. So we currently, this has been, in development for the past 4 years, what we call Inform Plus. And so this is really a revolutionary technology designed to do just that, to look at 100% of the discharges.
Wow.
We then will couple that with our physician-led clinical review that the technology identifies as an opportunity. So really, really interesting. We're super excited about it. It has, over 560,000 clinical guided pathways. This has been created by the Enjoin physicians, leveraging their decades of bedside clinical, experience. So we currently are rolling this out. We have ANOVA on the roadmap for Q3 of this year, and so just really excited for that opportunity and all the progress we've made from that perspective.
That's
That's
awesome.
exciting.
That's
very
incredible.
exciting.
I'm curious, Melissa. I'm curious. Your staff will have yet another change to face potentially with this. And what I hear when I hear Justin talking about this and ANOVA's in Q3 for looking at that, I hear the opportunity to upskill again to be reviewers for decision making for what your outputs are from this product, right? And it's not I guess what you've already learned is they're able to show you things that you all would have missed, and you've been more appropriately reimbursed. I'll say it that way, maybe more appropriately reimbursed for the care that was provided. So, do you have a do you envision growing your team in terms of headcount, or do you envision with this new product, because it sounds like you might get more to review potentially, will that grow your team, or will that just upskill or skill your team differently?
We're not exactly certain yet, but I think it's going to be a combination of both. Obviously we've had success already with the process that doesn't involve the AI technology that Enjoin has been working on. We've had success already with their services, and so we're looking at this in that we're just going to be able to apply the success that we've seen in the limited DRG focus list that we're using right now to a wider net of patients. And so it will result in more accounts coming back with needing that second level review. And so our staffing is going to change. We just don't know exactly how yet. So we've had to make some changes with the Enjoin process. On the CDI side, we have some, second level reviewers that look at all of those. But on our coding side, all of the recommendations go back to the original coder because we want to keep that education in the loop.
That's awesome.
So from the coding side, I don't think it is going to change much other than their charts per hour productivity may go down a little bit because they are having to look at those second level reviews. But on the CDI side, we probably will have to change our staffing a little bit. We just don't know exactly what that's going to look like. And one thing I forgot to mention, and I want to make sure that we call this out, in that the Enjoin process is to look at the integrity of the record, the documentation, and the codes from a whole, regardless of whether that results in optimal reimbursement, additional reimbursement, or compliance review. Revenue protection is what we like to call it, where we may have coded something that was not supported, and therefore it's changed so that we do get the correct reimbursement, which is not always additional reimbursement. So, and we look at that as audit defensibility of our records.
Absolutely. And that's really why I said appropriately reimbursed, because it isn't always finding a higher paid DRG. And if you have a vendor, Justin, I'm probably going to give you some props here, just accidentally or by default. If you have a vendor that says, let me get you more money all the time, then please stay away from that vendor because that's a risk you don't want to, you're not going to mitigate that kind of risk. You're going to pay.
That's not who Enjoin is. Again, and thank you for saying it, Melissa, because we want to take an absolute balanced approach to the review, and that results both in revenue lift and, as Melissa said, revenue protection. It's important that we service that. And I think, too, just to kind of add on to the idea related to Inform Plus, it's interesting because I'll be interesting, Melissa, as we look at that staffing level, because the idea would be, yes, just naturally you'll get more recommendations because we're looking at 100% of the discharges. And so you would almost think of a little bit of like a downward sloping curve as the education begins to kick
That's right.
in. Those teams should be learning, and so we'll have less over time.
Correct.
But then we're also there too as a safety net that as Melissa onboards new CDIs or new inpatient coders, that we're able to be there as a safety net to catch any opportunities that we may find related to that as well.
Yeah, for new staff, for new guidelines, for new, clinical concepts, for new coding rules, whatever the case may be, we really are looking at this as being that safety net that covers all accounts, not just those that we currently pick and choose because we feel that there's opportunity there, which is, a limitation from a staffing perspective of every hospital across the country.
Yeah. Justin, how can folks learn more about Enjoin?
Go to our website, www.enjoincdi.com. Also, we are on the road at HFMA conferences, ACTIS, AHIMA conferences, and so really try to hit many of those, both state and national shows across the country.
Well, thank you guys so much. This was exciting. Probably my favorite conversations to have are tech related to health information opportunities. And so I could really stay and talk for a long time. I have a lot of questions I'd love to just know about. And that's just because I'm curious, not because of any other reason, except for I just like to know. But thank you, Justin. It was really nice to meet you. This is my first time meeting you, so it was really nice to meet you. Thank you for the work you do in the health information community. Thank you for what you do for coding and CDI. Thank you for supporting our health information conferences and for specifically supporting Tennessee Health Information Management Association. And MK, it was so great to catch up with you. Congratulations on the second promotion in 7 months or something?
February was the last promotion, and it is now.
So less than 7 months. It's crazy awesome.
It's a few months. Yeah.
Thank you. Fantastic. Well, Shannon, until next time, my friend.
See you next time, buddy.
Appreciate it.